Hello, doctors. Well, today we're going to talk about a very uh, important issue, and it is the difference between the cardiac arrest versus the heart attack. They are both affecting the heart, but we will be looking for the difference because even though they have some uh, uh, similitudes, they are totally different. Okay, and so the link for these two diseases is that most of those heart attacks will not lead to a cardiac arrest. But on the other hand, when we are having a cardiac arrest, then the heart attack is a common cause for this. Let's take a look and let's uh, review these two diseases. So the question is a heart attack the same as a cardiac arrest? And the answer is no. Okay, both of them are different. When we talk about this cardiac arrest, it happens because the heart is not functioning correctly and it stops beating unexpectedly. The contraction function of the heart is stopped, suddenly stopped. On the other hand, when we talk about a heart attack, it occurs when the blood flow to the heart is blocked. So, when we talk about the cardiac arrest, we know it's the heart's electrical system malfunction, with it stopping the pumping action for the heart. So, we consider this is an electrical problem. Then, when we talk about the heart attack, we know it's the blockage that stops the blood flow to the heart. That's why we consider a heart attack as a circulation problem. So, again, cardiac arrest is electrical issue and heart attack a plumbing problem. So, they are not the same. A sudden cardiac arrest is not the same as a heart attack because when we talk about this XCA or sudden cardiac arrest, this victim will be unresponsive, not breathing normally because the heart is stopped. In this situation, our victim will be having the need of a CPR or AID. And when we talk about a heart attack victim, it's different because our patient will be responsive, he will be breathing, the heart is going to be working, it's beating. So that's why he will not need CPR or AED. CPR, as we remember, is this cardiopulmonary resuscitation. And when we talk about AED, it's the automated external defibrillation. These two techniques are really very important when are used together when they are looking for safe patient which is under a sudden cardiac arrest. Okay, let's talk firstly a little bit more about the sudden cardiac arrest or STA. This is, as we said, the abrupt loss of the heart function and breathing, and this is when the heart basically stops the contraction function. It's not beating properly, and it results in a complete cessation of the heart's ability to function and to help the circulate the blood efficiently all over the body. That's why they call this name. The heart's pumping function is arrested or stopped. That's where the name from cardiac arrest come from. Okay, because the heart it's not pumping efficiently. During this cardiac arrest, because of we are not having enough blood flow into the whole body, but mainly into the brain, most of the time this patient will be losing the consciousness. He will be under a sudden collapse. He will be unresponsiveness, He will be not breathing normally, and because of the lack of oxygen, he will might be suffering for cyanosis or this blue discoloration of the face. Most of the time, this is the first sign, and usually it's the only sign. We find we find our patient totally unconscious. As we know, this most of the time occurs suddenly and often without any warning. Okay, just to remember, this sudden cardiac arrest is triggered by an electric malfunction in the heart that causes an irregular pattern in the patient's heartbeat, which is, as we saw last week, uh, just known like arrhythmia. And this arrhythmia will stop the pumping action because the heart is not beating properly. It has no rhythm, so it's difficult to pump. And this is the consequence will be that the blood flow will be not continuous. And as we said, the first parts of the body that are suffering for this lack of blood flow is the brain, then the lungs, and of course the whole body. Uh, as we said, this is not the same as a heart attack because the heart attack is the flow that is blocked, and but however, or we may see that a heart attack sometimes may trigger an electrical disturbance, and therefore this electrical disturbance would lead to a sudden cardiac arrest because of the arrhythmia. Okay, some causes for sudden cardiac arrest are arrhythmias, as we have been talking. We also have the coronary artery disease, cardiomyopathy, a long QT syndrome and Brugada syndrome, Marfan syndrome, and some. We have also some common risk factors. Talking about arrhythmia, we know that the most common cause of this sudden cardiac arrest is these arrhythmias. Because, as we said, the patient heartbeat is very irregular and has an abnormal pattern. It can go, as we know, too quickly or too slowly, as we can see in this second degree partial block, or we can see in this atrial fibrillation, we can see how there's no peace. We can see the ventricular tachycardia. We can see even the ventricular fibrillation with a total abnormal trace, or the third degree block. Just let's remember that usually our electrical geographic trace should be always having a P before the QRS complex and followed by the T wave. And the examples, as we said, the second degree or partial block, we can see how only half of the P waves are not followed by the QRS and the others are. In the atrial fibrillation, we have this abnormal electric pattern before we have the QRS complex, and the frequency, as we can see, between those QRS has increased. As we can see, the frequency has increased. When we talk about ventricular tachycardia, we have the shape of the QRS, it's very different, and we can even see this S wave. And finally, to the third degree block, we can see that in this situation, the impulses are initiated by the sinoatrial node, but they are not reaching the AB node. Some of them are, some of the others no, but also we know that the P waves are not followed by the QR complex. Now, the most common heart rhythm that causes the sudden cardiac arrest is the ventricular fibrillation, because instead of contracted and beating properly, the lower heart chambers, which are the ventricles, quiver or they shake, in a way that interferes with this cardiovascular function. This pattern will be very fast and be erratic, and of course will lead to the sudden cardiac arrest. We know that the sinus node will be having the sinus rhythm for the heartbeat, but then when the sinus node is totally with no control, these ventricles will quiver and fast erratically. The result will be this trace in the electrocardiogram. As we can see, there's a total lack of normal electrical activity. Uh, we know about this coronary artery disease, which is blocking by the time the blood vessels, and then the supply of blood flow will be less, more and more. This is uh, this disease. It's when we develop those plaque builds in the coronary artery, and as we can see, those plaques will be blocking the light of the vessel. And as we know, if there's a plaque that has a rupture or is broken, then we remember those blood clots will be forming, and of course these blood clots will stop the flow for the for the arteries. Also, when we talk about cardiomyopathy, we know this is a different kind of diseases that are interfering with the circulation in the heart because they are affecting mainly the muscle. This will be resulting in a muscle wall, which will be swelling or thickening, and by the time this wall will be weaker more and more, and that's why the heart will be having a really hard time to pump and maintain a regular heartbeat. Mostly we talk about the heart muscle impaired in both systolic and diastolic function, and we know this muscle can be enlarged, thick, or rigid. When we talk about the Marfan syndrome, we know that this will affect the main vessels of the heart, mainly the aorta, and it might even cause an aneurysm. There's also, in some occasion, leaking from the heart valves, and it's causing heart palpitation. We also have the long QT syndrome, where these electrical activities of the heart are interfered. The rhythm is going to be irregular and can be very dangerous, of course, like those arrhythmias that are life threatening. And just to remember which are those common risk factors for this heart affecting function, we know that high cholesterol, high blood pressure, inactive lifestyle, smoking, age, diabetes, of course, obesity. And if we have any family story or family background, we know that we should be changing those lifestyles in order to avoid a sudden cardiac arrest. Okay, and now when we talk about the heart attacks, we talk about this myocardial infarction, it refers to the necrosis or the death of the heart muscle tissue because it's losing oxygenated blood. Okay, we know that we will find something that is blocking the artery, and this will be stopping the blood flow. So by the time this heart muscle tissue will be suffering, and the arteries will be blocked. That's why we say this is a circulation problem, because the blood is not passing through the arteries in a regular way. When we talk about the heart attack, most of the symptoms will be developing very slowly because the blockage would be like not a sudden situation, but with the time the light of the vessels will be narrowing more and more and more. So that's why in this situation the heart will not stop completely, even though there are some other heart attacks that are sudden and intense. Okay, as we said, these arteries are narrowing and the heart will be having trouble supplying blood and oxygen to the body. And we also know that those blood clots that appears inside the vessels, then they might be uh, having the result of this blockage in this heart attack, which could be in somehow life-threatening situation too. We know that these fatty that it's deposits that are around, they will be also growing up inside, and then it's when the heart attacks occur. In this part, the muscle is suffering and is dying. When we talk about the electrocardiogram trace, we know that the ST segment will be elevated, and we call this like ST segment elevation myocardial infarction or STEMI. And this is the most serious type of the heart attack because there's a long interruption to the blood supply. It is the result of a total blockage of the coronary artery, and it will cause an extensive damage to a large area of the heart. This muscle will be dying, and then the heart may eventually stop. As we can see, this is the elevated ST part of the electrocardiogram. And as we can see in this part, we can see the normal ventricular wall. And then when we have ischemic area changing, ischemic zone, the damage now in this part, the injury, which is represented in the electrocardiogram trace, and finally the ischemic zone with the infarction. So, just to finish, sudden cardiac arrest, it's a life-threatening situation, very dangerous, and a heart attack is a circulation situation that it's not life-threatening, but eventually may lead to a cardiac arrest. So, what should we recognize? Well, sudden cardiac arrest is electrical malfunction in the heart. The heart will stop beating unexpectedly. Our victim will be suddenly unresponsive. We will find abnormal or no breathing, and we may also find seizure activity. What should we do? Call 911 and start CPR. Some maybe will use the nearest AAD. And when we talk about heart attack, we know it will occur when the blood flow is blocked to the heart. The section of the heart it's not getting oxygen rich blood. The victim will remain conscious but symptomatic. It will maybe under chest pain, arm and jaw pain. He will be having shortness of breath. We should also call 911, but we just have to support our patient until the emergency services, medical services arrive. So finally, sudden cardiac arrest is an electrical problem. The cause is an electric malfunction in the heart that has it's causing irregular heartbeat. The blood is stopping from flowing to the body into the brain. Uh, those risk factors, if we have a previous heart attack, if we have heart failure, if we have a normal heart rhythm, if we have a low ejection fraction, or even any family background of a sudden cardiac arrest. The time for those symptoms, it could occur anytime before we lost the consciousness and collapse. The symptoms, as we know, is collapsing, unconscious, no breathing, no pulse. Then what should we do? Call 911 or any another emergency number. We must start CPR and use the automated external defibrillation if we find someone nearby. And if we do not take this CPR, our patient may die in the couple of minutes. On the other hand, when we talk the heart attack, as we know, it's a pumping problem. The cause is because the blood flow is blocked, and it can provoke a permanently damage to one part of the heart or the total heart. The risk for this heart attack is if we have a high cholesterol or high blood pressure, if there's a background in the family for a heart attack, if we have diabetes, obesity, or we are smokers. The time for those symptoms, it may occur in hours, but also days before the real symptoms are recognized. For the symptoms, we may be under chest pain, we may be feeling weak or fatigue, we may have nausea or difficulty breathing. Then, why should we do? Call 911, start CPR if our patient is unconscious. If he is unconscious too, we may use an AED or automated external defibrillator. Okay, so I hope, doctors, that you understand which is the difference for these two conditions that has a very high incidence in our population. Thank you, and see you in the Zoom to talk about this.